So that video of the health MEC in Limpopo chastising a foreign woman in a local hospital has really put the issue of foreigners living in South Africa centre stage. Some feel that the MEC was perfectly within her rights to paint a realistic picture of how helping foreigners in our hospitals can lead to less for South Africans. Others see her utterances as xenophobic, even intimidating, particularly to that patient. Well, I'm joined now by Dr. McKinley of Kopanang, Africa Against Xenophobia. Dr. McKinley, this is such an interesting case. Do you think she was being xenophobic?
Absolutely. It reminds me very much of her denial, her bald-faced denial. It reminds me very much of when people who've uttered racist commentary and are asked, are you racist? And they say, no, some of my best friends are black, or whatever the case might be, a white racist. I mean, you cannot act like that. You cannot belittle somebody simply because of their nationality. You cannot abrogate the professional code of conduct of doctors in the Professional Health Association. You cannot act in such a demeaning kind of way simply because somebody does not speak a particular language or doesn't. She mention absolutely nothing, for example, about whether this person was illegal or not. No proof of that in any way. So when you say things like that, and it comes across, of course it's xenophobic. And this continued denial of the minister, of everybody else, we're not being xenophobic. You know, the violence against foreigners is not xenophobic. It basically points exactly to the point that it's foreign nationals, whether or not, now it's all foreign nationals, whether or not they are in this country, they've lived here for 20, 30 years, whether or not they are undocumented because of the corruption and the mismanagement within the Department of Home Affairs. None of this seems to count at all. Now it's just a bald-faced kind of generalization. We're being overrun by illegal foreigners. She sounded very much like a member of Operation Dudula, as far as we're concerned.
So tell me something about, you know, you say you feel it was very xenophobic. Was she also correct? Do we have a problem, particularly in Limpopo, of foreigners, many undocumented, who come into South Africa for medical care because their countries perhaps don't offer that? Is that an issue?
Well, you see, the question, of course, in our health system, we have a constitution and we have laws that basically say that if you are here in this country, you cannot, first of all, be refused emergency medical treatment. And you have just as many rights if you have the documentation as anyone who's a South African citizen. Now, all of the evidence and all of the research, we pointed this out when Operation Dudula and Action SA and others began to say there are 15 million illegal immigrants in South Africa, and they're overrunning everything, not just the healthcare system, but all sorts of other services. And all of the factual research has debunked this. And the MEC gave absolutely no proof whatsoever. If she has statistics to say that there are millions and millions of illegal immigrants that are overrunning the health system, well, then show it and show us exactly what it is. If you cannot do that, then what we have to assume is that basically what we have is we have a situation where the problem does not lie with people who come in and try to get basic medical assistance, wherever they're from. It relies within our immigration system. It's a situation with regards to corruption and mismanagement of the DHA. It's a situation of where the health budgets have been smashed and cut back over the last 10 years. It's not simply, she mentioned absolutely nothing about, for example, the millions of poor South Africans who cannot get health care, which has nothing to do with illegal immigrants, but has to do with the healthcare system that has been dysfunctional and is in crisis. So we need to look, and the MEC needs to look very closely in the mirror and with the health department itself and with her principals in the national and provincial level, and ask herself, why do we have a situation in which the health system is in crisis for everyone, irrespective of how many foreigners are using it or not?
Do we have accurate stats on legal foreigners living in South Africa and undocumented foreigners? Do we actually know?
Well, we've pointed this out as the Kopanang, that the statistics that we have been able to access from Stats South Africa, from all the academic research that has been done in Gauteng, where the large portion of foreign nationals reside in this country, is that we have, and even the statistician general just a few months ago said that all the information at their disposal, at our National Statistical Agency disposal, would indicate that there is less than 4 million foreign nationals living in the country. And that includes all that they can count, and including, of course, one cannot indicate that that is an exact figure, but it's way, way below what is oftentimes just pushed out there with millions and millions and millions that are overwhelming things. So if we take that, and then if we take the fact that a large portion of those foreign nationals are legal, and then another large portion of them are undocumented, not because they are trying to, for example, get around the system or cheat the South African healthcare system or whatever it is, but because their documents have been stolen, they haven't been able to get the renewal of their permits, they have to travel hundreds of kilometers to go because refugee centers and asylum seeker centers have been centralized in Pretoria. All of these kinds of issues give us a situation where we can say that we've got a problem, but the problem is not with necessarily individualizing foreign nationals who are coming over and overwhelming. The problem is with a system in South Africa that has not been able to allow for both the legalization of the vast majority of people that are here, but also we can talk about our foreign policy and whether or not South Africa itself is fundamentally partially responsible for the economic and social crises in Mozambique and Zimbabwe, which is a whole nother story.
Yeah, I mean, I think the argument that the people are putting forward in response to what she's saying is, yes, we know we've got an ailing health system. So shouldn't South Africans be prioritized? Is there anything in law that says it should be South Africans coming first? And the reason I ask that is because someone responded on social media saying, this is why, if you're standing in a queue for medical care and there's a foreigner in front of you, you must send them to the back of the queue. But our constitution doesn't allow that, does it? Whether you're here with papers or without.
That's correct. So if all the people that are saying, you know, it's incredible that you're going to say that foreigners should be pushed to the back, irrespective of whether they are here legally, irrespective of whether they've lived here for their most entire lives. For example, many immigrants here who have children that have never been into their country, that their parents were born in and yet are going to be told that they must go back home. This reminds one of a fairly right-wing, conservative, narrowly nationalist, xenophobic agenda that we see in Europe, that we see in the United States, that we see across the world, where immigrants are blamed for pretty much everything because they're an easy particular target. What we need to talk about is that we are a wealthy country. Where is the money going? Why don't we have a healthcare system that functions properly? Why is it that South Africans, irrespective of whether they're citizens or irrespective of foreign nationals who go to a clinic, are given panados for massively serious diseases and other kinds of injuries that they might have? Why is it? Well, we know some of the answers to that, but nobody wants to really talk about those kinds of things because the easy target is to say foreign nationals are the problem. You get rid of foreign nationals and then everything's going to be okay. We know that that's not the case. So we need to have a serious, responsible debate about where the problems really lie and stop scapegoating foreign nationals.
Nevertheless, what the MEC is saying has resonated quite profoundly with a lot of people who just feel that the system isn't fair. Do you think we need a policy change? And the reason I'm asking that is because the MEC said, if I go to Canada as a foreigner, I'm not allowed into that country until I can show I can pay for my own health care. That sounds fairly sensible. So what is the system here? I mean, what are the rules here? Or is it that, you know, is it anything goes?
Well, no, it's not anything goes. It's, of course, what we have is if you're in this country legally, if you're a tourist, if you're on a tourist visa and you're here for 3 months enjoying, if you're from Europe or wherever you are, or whether you are coming from Zimbabwe or the DRC or anything, and you're here and you're doing some business or whatever it is, or you're visiting relatives, everything, to say that simply because you're from another country, you have no right to access the healthcare system and to be taken care of is just unacceptable. And in fact, the one thing that South Africans used to celebrate was that we were not like other countries. We were not like the United States and others, which treated oftentimes immigrants and others as foreigners that had to be sort of, you know, watched all the time and corralled. That we talk about PanAfricanism, we talk about African unity, we talk about Ubuntu, We talk about all these kinds of things and celebrate them. But then when it comes to the practical aspects of things, it's another story. So we have to practice what we preach. If people want to change laws, then advocate for the changing of laws and lobby the government to change that. Then we can have a debate and an open debate. But don't go after the easy pickings, which is foreign nationals are here, they're taking advantage, they must just be kicked out. We have fundamental systemic problems in our society that have nothing to do with foreign nationals, whether it's our healthcare system, whether it's our transport system, whether it's our water, electricity system, and we know why these problems exist. Why are we not responsible enough? Why are we not responsible enough to tackle those things and to admit that we need to sort our own mistakes out before we start blaming others?
What about her comment about President Emmerson Mnangagwa in Zimbabwe, that they've tried to get money out of him? I mean, is there, if we're talking Pan-Africanism, is there any sort of quid pro quo system where there could be almost like a regional pool to look after people within this region? I mean, is that something that is far-fetched, or do you think that's potentially a good policy suggestion?
Well, in theory, it would be great. Absolutely. If I mean, the SADC, if we had no borders, it would even be better. If we had, free trade and free movement of people and all sorts of other things, well, then we wouldn't be having these kinds of problems, because people wouldn't feel the need to cross borders illegally and to engage in illegal work, and for people to be taken advantage of and paid really bad wages and living working conditions. So, of course, in theory, the problem, of course, lies with the nature of the governments in some of the surrounding countries, including ours, which we have going all the way back to our silent diplomacy with President Robert Mugabe. We looked the other way as Zimbabwe went into a spiral, a downward economic and political spiral. And the vast majority of people who arrived in our country at that time were escaping political persecution and economic disaster. And we had a degree of responsibility for that. So if we're going to take regionalism seriously, then we must begin to pay attention to the politics and to support our own constitutional values and our own principles, not just in our own country, but in our foreign policy as well. And I'm afraid to say that when it comes to that, we've been asleep at the wheel.
Thank you so much for speaking to us this evening. Much appreciated. Dr. Dale McKinley of Kopanang, Africa Against Xenophobia. He says, pick on the right people, live by our constitution, which enshrines the rights of foreigners to get medical care.